It is second week in a row since the doctors' strike started. Public hospitals are deserted with medics, while the Kenyan public, those who cannot afford medical attention from private facilities, are stranded in the compounds of these public hospitals. The national government and county government are playing gimmicks, blame games, and changing goalposts one meeting after the other. And even to make it worse, the cabinet secretary who is in charge of health, Dr. Susan Nakhumicha, Wafula Nakhumicha, even disappeared, or rather skipped, a meeting that was convened to find a solution over this impasse. The government has held its position that the doctors are demanding for full implementation of the 2017 CBA that was even registered in court. The government is saying, we don't have the money. But the other side of this, they are at an advanced stage of employing the over 50 CAS that the court declared unconstitutional. Who is going to listen? Who is going to blink? The doctors are saying that we need to employ these interns because they will help us bridge the health personnel gap, because the number of hospitals, the number of doctors ratio to patients is actually very low. So one doctor is serving many patients, and that cannot even help us achieve the universal health coverage. Ladies and gentlemen, I want us to look at today's piki ponki between the national government, counties, and the doctors' union. My name is Kevin Oduor. There was a meeting that was to be convened today in the morning, and that meeting was to bring together KMPD officials and the county governors, especially the governors caucus that is in charge of health. There is a council of governors committee that is in charge of health, led by Tarakaniti Governor Muthomi Njuki. And in that meeting, KMPDU was supposed to be there with the county governors and the Ministry of Health officials led by Nakhumicha. Believe me, the Health Cabinet Secretary, Nakhumicha, skipped that meeting and did not even attend. So KMPD officials were left with no other option but also to walk out. Only later for Anwai Guru to come up with threats telling the doctors that those who are employed by counties, you either report to work or you face disciplinary.
Encourage the union to negotiate the new CBAs with individual county governments who are their employers. This cannot be negotiated from the national level because health is a devolved function, and we urge the national government, the county governments, and the doctors to exercise sobrieties as parties, resolve these matters amicably. We also call upon the doctors who are on strike to go back to work pursuant to the court orders issued on 13th March 2024 and 15th March 2024, failure to which the respective county governments who are their employers will be at liberty to take any appropriate action or disciplinary action.
So this is it. That was Anwai Guru. Now, of course, the public, Kenyans do not have the luxury of knowing who to blame. They don't even want to know who is to blame now. What the public want is that when they walk to public hospitals, they should find the doctors, just the same way they have been paying taxes. It is as simple as that. Now, this is one matter that I think there have been a bit of some internal sabotage. I listened to, there have been calls from the opposition benches asking that William Ruto personally should take charge of these negotiations with the doctors, because the CS Nakhumicha is actually failing in her mandate to cool down the unrest. And Babu Owino really chided the cabinet secretary while speaking in Narok.
Lastly, ningependa kusema hapa ya kwamba wale wazuri ndio wanaenda, lakini wale wabaya ndio wanabaki. Wale wabaya, wale wazuri kama Rita anaenda mapema. Wale wabaya kama Nakhumicha wanasumbua madaktari ndio wanabaki hapa Kenya. Nataka kuambia rais awe na mkutano na madaktari, wagonjwa wanakufa sana.
So that is where we are as a country. Something is simply not adding up. It is enough to ask Nakhumicha to step aside. And of course, the whole of competence and the way she's been speaking about it, it's not much of what she's been saying. Now, later on, after skipping that meeting with the Council of Governors, remember the CS had even been blaming the Council of Governors that there is part of the CBA that was supposed to be implemented by the governors, and the governors had not done their part of the bargain, and so her office should not be called into it. What we later saw is that one whole nation, it's called Whole Nation Approach Meeting. The Whole Nation Approach Meeting is where you bring all the respective stakeholders, starting from State House to the ministry, to KMPDU and to governors, and that meeting was later called in the evening. So after declining to meet the doctors with the doctors union with the governors, then this meeting later came, and you know, it never even gave a solution. This is what Nakhumicha is saying. The second Whole of Nation Approach Meeting in compliance with the court order was convened today at the KICC. The session chaired by the Deputy Chief of Staff Josephat Nanok, who on behalf of Head of Public Service Felix Kosgei focused on the way forward on how to find a lasting solution to end the doctors' strike. Let's put the interest of patients ahead of ourselves and comply wholly with the court order. The government is determined to fix HRC issues permanently, health-related issues permanently. Now, there is the same court order. You know, I'm even wondering, yeah? The same court order, the doctors' union have also been blaming the government, have failed to meet their part of the bargain.
Evening, as you are to start the meeting, they decided to all stream out of the engagement, saying that they don't bother and they don't care how long the strike takes. So as a union, you want to say that we will continue being out until the government sits down and be ready to resolve the issues we have.
Katibu mkuu wa KMPDU Daktari Davji Atela ameishtumu serikali kwa kuja kwa mazungumzo na nia isiyokuwa njema. Muungano huo umeapa kutositisha mgomo wao hadi pale matakwa yao yatatimizwa kikamilifu.
We have asked the union anytime between now and 1st of April that if they comply with the ruling and lift the strike or stay the strike or suspend it, then we will proceed to call the next whole of nation approach meeting.
But government is clinging on a court order that asks the doctors to return to work immediately. But they're saying, you know what? The same court order, there was a court order that was given for government to comply and adhere to the provisions of that CBA, and it was never done. Now, at the end of this, the government is playing games on this doctors' strike. This meeting, popping from that meeting, changing a goalpost, going to the other meeting, having a different position. And at the end of the day, all those seated in that meeting supposed to provide the solution are not affected. The cabinet secretary have a comprehensive medical cover, very elite medical cover, that she can even be flown out of the country immediately if things go worse, she's not affected. She can even afford this to get medical attention from private. But Kenyans from the lower cadre, the hustlers, cannot really secure health services. Now, I have been seeing, and this one, you guys need to challenge me to give me some explanation. I have been seeing William Ruto coming out boldly to defend government on housing levy. Even recently, I have seen William Ruto boldly defending government on the transition from NHIF to the SHIF. Now, I am seeing doctor strike, something that is also affecting the hustlers. Why is the president quiet? If there is something that they have failed to comment about, is this one. William Ruto has been in churches on Sunday. And because this is going on, unaona sahi society haiwezi ongea, let the doctors go back to the hospital. He will go back and now say the way they have done something, they have spoken to the government, they have done, he will now speak the poetic talk. But now, he is very quiet. And I think this is what many people have been asking, because there have been calls for president to take charge. There have been calls all over that let president come and take charge. He's the man who believes to be in charge of everything. He's been calling them. Hata wakati wa housing levy, ameita madaktari. But there is something. Why he is not coming through for this? There are three reasons. Number one, let me tell you, and this is not something predictable. The 2017 CBA that was signed, that government failed to obey, he was a deputy president. He was a deputy president. And was part of the team that negotiated that CBA. That, remember, the doctors had even gone for strike for nearly a whole 3 months. They paralyzed health sector for 3 months, 100 days, the longest health doctor strike since independence. That time, the CBA. So, it doesn't have any other reason to say why himself is conflicted on this matter. Number two, there is a new strategy to disassociate the image of William Ruto from Kenya Kwanza setbacks. So Ruto will only come in to take credit for what is good. We are not shocked of this, because even during Uhuru Kenyatta's time, this was the problem. And Uhuru complained, even in his exit speeches, Uhuru Kenyatta complained that this gentleman is my deputy. We were elected together. When things are bad, he is on the other side. But whatever has been done that is good, he's taking credit. Now, this is what is happening now. Is realize there are a couple of few things that are not going on right, and there are a couple of few things that are going on wrong. So he's choosing to associate with the right things. But what are setbacks? He's choosing not to disassociate, to try to disassociate with the setbacks, because he's the face of government. And lastly, I see if Ruto comes to the table, the doctors have an MOU that was signed by Kenya Kwanza during campaigns. That MOU is somewhere lying under the table. And that is why I think the president is keeping his cool over this doctor strike. Thank you.
Hi guys, so we're here as we had promised that we were coming to this other side of Kibera to deliver the wheelchairs. So because of the other residential training that the mothers of the kids had, we had to reschedule to this Sunday. And we've come here to Nakhumicha. We've brought the 5 wheelchairs that we had earlier stated. Even though we've not, wazazi wengine hawakumake, to manage around 3, yeah? Yeah. To manage 3, others are absent, but we've had the 3 that wako hapa. But the other wheelchairs we have, so tuna believe kwamba the team itawapatia wataweza kupewa the wheelchairs. Now I want to but I want to give each parent atasema something a minute. But before them, I need to introduce these 2 ladies around me. I know you're seeing them you've seen them for a second time. So Kawira is normally our admin. Sasa tukishafanya, she's the person that an engine behind all this, and we also have else on this end. So Kawira, itabidi uongee na watu alafu tuwapatie.
Okay, so for me, I'm just going to say thank you for the people who came through. As you can see, we were able to get the 5 wheelchairs. And thank you so much kwa watu wenye waliweza pia come through for us, mkatupea the funds. We really appreciate, and also for the management, we just want to believe that wenye wajamii kukuja pia watapewa zenye zimepatikana. I think that's all for me. Thank you very much.
Yes. Mama Benja, I say something.
Okay. Mimi nasema ni asante kwa hiyo organization yenu ambayo mmeamua mnasaidia watoto wenye wana disability. Pia nashukuru kwa hii wheelchair ambayo mmetusaidia nayo. Kama mimi nilikuwa already, watu walikuwa wananicheka kila wakati ni mtoto wako kwa mgongo. So nimefurahia kwa sababu Benjamin atakapokalia hii wheelchair itakuwa ni kazi rahisi, ni kumsukuma tu, nikimlete therapy, maybe nataka kuenda somewhere, ni kusukuma tu. Nashukuru kwa hayo ambayo mmetenda na mzidi kutenda. Mbarikiwe sana. Ni hayo tu, na mbarikiwe.
Naitwa Eva ama Njeri ama Mama Nancy. Nancy ndio huyu. Kwangu ni kurudisha shukrani kwenu. Juu ni wengi, watu ni wengi wangetukumbuka lakini hawakutukumbuka, lakini nyinyi mmetukumbuka na sisi tuko hapa tukisema ni asante. Mungu awabariki na waongezee wema.
Na mimi naitwa Sara Kemto, Mama Gloria. Gloria ndio huyu already amekalia wheelchair. Na mimi nashukuru Mungu kwa sababu yenu. Mungu amewatumia, mmekuja kutusaidia. Ndio watoto kama Gloria ni mkubwa, kumbeba kwa mgongo ni shida. Nashukuru Mungu, Gloria amepata wheelchair, ataendea shule Januari. Wacha Mungu awabariki. Mali hiyo pesa imetoka na Mungu airudishe. Mbarikiwe sana na Mungu awaongezee. Nimeshukuru. Thank you.
Yes, so yes, on behalf of this amazing team, asante sana. I'm just sure of words. We mentioned that intervention ya disability, we will try to still upscale. Nimerealize kwamba the number of kids in need of wheelchairs ni wengi sana. We cannot, but I believe with this start, as we roll into 2024, we'll be able to support and develop this as a full program and support the team that we have here so that we move forward. Asante sana.